Hello, everyone, and welcome to AceOSCE's case for today. Today, we bring you a new case where the patient actually has a concern when they drop off a prescription. Now, in these cases, we may not have the patient profile with us because it could be a new patient for us. So, let's make sure we budget our time wisely, get all the medication history before we get started with the case and give our recommendation. Outside your door, you get the note. A patient is coming to you with a concern. Do as you would in your regular practice. Whenever you see this note, make a note that this is a patient, so no medical jargon to be used to communicate effectively with the patient. Have your empathy and sympathy skills out and use the DOSAM abbreviation in case we have to correct information. Once you go into the room, make sure to have a smile on your face, give your barcode to the assessor, have a quick look at the reference on the OSCE table in front of you before the person comes in. Once they do come in, make sure to stand up, acknowledge them, and introduce yourselves. Hello, I'm Tina. I'm the pharmacist on duty today. How could I help? Hi, I just had a couple of questions regarding a prescription that the doctor gave for my son. Yeah, for sure. I'd definitely like to help you out today. Please have a seat. How could I address you? My name is Marie. Thanks for coming in, Marie. What are your questions today? So, we went for an annual physical checkup of my son to the doctor, and the doctor seems to be wanting to give my son a chickenpox vaccine. He's just a year old. Do you think this is the right vaccine for him? For sure, I'll definitely have a look to make sure that I give you the right recommendation. In the meantime, do you have any other questions for me? Yeah, just in case I do need to give this to him, what are the potential side effects that I'm looking at? What should I be wary of or look out for? That is actually a good question to ask, Mari. I'll definitely have a look at my reference to give you a good recommendation. Before I do that, however, I may need to ask you a few questions regarding your son's medical history to make sure that I give you the right recommendation. Is that okay? Yeah, for sure. Okay, so I don't see a patient profile here for Ryan. Has he been to a pharmacy before? No, he hasn't. Actually, this is his first prescription ever. Okay, okay. So, how old is Ryan again? Um, he is 12 months of age. Okay. Does he have any medical allergies, any medical conditions, any over-the-counter medications you give to him? No, he has no medications at the moment. He has no known allergies at all either. Okay. Does he have any bothersome symptoms, which is why you went to the doctor for? No, he doesn't. It was just a basic annual checkup. That's it. Okay. And do you have any other information that I should have before I give you my recommendation? No, I just have concerns about the vaccine. Okay, perfect. I will have a quick look at the prescription so I can make sure what I'm looking at out for. And I'll look at my reference and get back to you with the answers. Just wait for a couple minutes. Have a quick look at the prescription here. It does say Ryan Davis, who's 12 months of age, male with no known allergies, being prescribed the varicella vaccine, which is the chickenpox vaccine, 2 doses of it by Dr. Chan. It seems like a prescription that seems to be very regular and very normal. Now, we have confirmed everything with the patient's mother already, and everything seems to be most updated. So, this is our prescription in front of us. Do make sure to write down any other details that the patient may give you, which you may not see on the prescription in your rough sheet, just in case that does make a difference in your recommendation so that we don't forget it. Now, before we go into our reference, we do want to make sure that the patient has no other questions, which we did double check by asking her if she had any other questions for us. Let's have a quick look at the reference now. As per our reference, it does state that the varicella vaccine is a good idea for the child. Who should get this vaccine? It does state that other than the case where the patient is allergic to any component of the vaccine, which in this case Ryan is not allergic to any known drugs, at the age of 12 months, which is the first year, the chickenpox vaccine should be given in the first dose, and between the ages of 4 to 6, the second dose should be given. So, in this case, to answer the first question, it seems like a good idea for Ryan to get his first dose as he is 12 months of age. Just to kind of give a little extra information to the parent, we can also read out information from the section that states what are the benefits of getting the chickenpox vaccine. That does state that it is better to give the vaccine to prevent chickenpox episodes than having the chickenpox episode itself. So, that is another piece of information we can give to the mother. Now, to skip on to the second part of the question, where she was hoping to see what are the side effects that the vaccine could cause, you could definitely let her know from whatever you see in the last section of this reference, where it states that usually the vaccine is very safe. However, it could cause redness and swelling in the area that the injection is given. Also, in some cases, the patient may actually have a chickenpox episode with milder spots and fewer spots, though, but it may cause this chickenpox to spread to other people. In order to prevent that, we do want to cover the lesions until they are crusted. So, this is the answer to her second question. Once you've had both the answers, let's refer to the patient back. Thank you for waiting there, Marie. Now, as per my reference here, I see that Ryan is 12 months of age, and as long as he has no known allergies, which is the case at the moment, he is a good candidate to get the chickenpox vaccine. Usually, it is a two-dose vaccine where the first dose is given at the age of 12 months and the second dose is given between the ages of 4 to 6. Now, it is a better idea to get the vaccine than having the actual chickenpox episode, which is why I think giving Ryan the first dose of the vaccine at his age is a good idea. In order to answer your second question, what could be the potential side effects of the vaccine? Now, there could be some soreness, some swelling, some redness at the injection site where we give the injection or the doctor gives the injection to Ryan. So, those could be potential side effects. In rare cases, there may actually be a chickenpox episode which is less severe than the actual chickenpox episode and with milder spots or fewer spots. In that case, the chickenpox would actually be communicable to other people in the family or immediate vicinity of Ryan. So we do want to prevent that by covering the lesions until they crust. So those are the possible side effects of the vaccine. Have I answered both your questions that you had for me? Yes, you did. Would you have any other further questions for me today, Marie? No, I don't. I hope I've clarified everything that you had in mind for now. Would you want me to go ahead and fill this vaccine out? Yeah, for sure. Perfect. You can always reach out to me in case you have further questions. I'll go ahead and fill this out and give you a call once it's ready. Thanks for coming in. Have a good day.